Hi,
Blasphemy.
everyone. I'm really excited to speak with Michael Pham again, Dr. Pham, or Michael as we all know him. It's been almost 2 years since our last conversation was recorded, and he is still working as a pediatrician in Saipan, a remote island in the West Pacific. And Michael has had some really incredible experiences over the last 2 years, which is why I wanted to speak with him again today. So, Michael, thank you so much.
Hey, it's always a pleasure, Carissa. You are a dear friend, so anything for you. It's always good to see your face.
Well, thank you, Michael. So, Michael, 2 years into clinical practice, you are a general pediatrician by way of review in a very, very remote island in the Pacific. Tell me, 2 years later, the last time we chatted, you were just sort of settling into this new job and this new position. Tell me what the last 2 years have been like, and we will eventually make our way to the typhoon.
The last 2 years, honestly, it feels like there's always a point of transition in my life, right? Because there's almost like there's no sense of stability at all. The last, between high school, college, medical school, residency, fellowship, and all the years that came afterwards, you always had a sense of transition. And truth be told, Saipan was supposed to be a transitional point as well, to be frank. I had no intention for to be here as long as I have. But the thing about staying in a place that actually feels natural to you is you end up growing roots, and it feels like these roots might stick a little bit longer than I anticipated. So yeah, it feels like I'm growing here. It's great.
Yeah. And so tell me, Michael, what is your clinical practice like 2 years into it?
So it's basically full all-encompassing practice. You do inpatient, and inpatient includes general pediatric floor, neonatology ICU, pediatric ICU, newborn nursery, and then you have to cover the ER consults, deliveries, um, and then clinic like as well. We also do clinic as well, so it's full scope.
Okay. And was this something that you had anticipated prior to starting there 2 years ago, or have your responsibilities evolved over the last 2 years?
To be honest, when I first started 2 years ago, I don't sure if I really had any expectations at all. I was just like, just get me out of here and let me put me somewhere useful.
Yeah.
and they're putting me to use. And I think in terms of evolution and of expectations, it was like the first day I was working, they called me out of clinic to do an emergency stat echocardiogram on a kid that was effectively dying. So that was day one. And then after that, they told me, I promise you, it's not like this all the time. And I figured out that was a big fat lie. It's like this all the freaking time.
Yeah.
And so, you know me well enough to know that I kind of live on adrenaline and on a prayer,
Yeah.
and I got at least 50% of that component here just being here in Saipan itself.
Wow. And so what has surprised you the most about practicing medicine in this way?
Um,
Your ability to adapt?
this well, first off, there were two things that surprised me. I think the thing that surprised me most was how natural it felt to me to practice this. Because prior to this, it was, as you know, all about cardiology, and this was like a plan B. But then, if just within the first week here and doing that first medical transport off island with a baby with rectal atresia and who was green as grass, on a United Economy class flight, giving calcium and without any sense of vitals, chaotic, but also I felt again I was capable, and then I felt like a niche. And this is the thing that I truly didn't expect at all, because you know how American medical systems are. You felt appreciated,
Sure.
yeah, and so that appreciation was wildly missing from residency, fellowship, and jobs that came after that. And so
Appreciate, sorry, Michael, appreciation from your patients, from your colleagues, from who?
all the parties, every party, all the parties. American medicine has such a toxic culture sometimes. Sometimes the nurses are pit against the doctors, or doctors are pit against the nurses by the admins. The admins are always pitted against the bedside providers. And then, of course, unfortunately, the people that we help, despite our best efforts, can turn around and then bite you on the hand,
Sure.
despite you trying to improve their life. And so, that culture doesn't exist here in Saipan, which I greatly appreciate, and I think that's what I needed at the time.
When you say that culture doesn't exist, is it the level of bureaucratic oversight, or is it the litigious patient-physician relationship?
So the lawsuit culture, even though you can sue here in Saipan, the general culture is not to sue, because if you make the locals understand it, so you make it so harsh that even the basic physicians don't want to come here, despite getting a pay cut, that will ruin their provider
I
line,
see.
because we're not getting compensated super a lot here, right? We work a lot. It's kind of a sacrifice for us to be here, and so that's one thing I think the locals as a whole have acknowledged, that they want to have some medical care. They need to understand that we're just trying our best. Um, and then the other thing is that, in terms of like admin and getting in the way, there's admin. There are limitations of what we can do. I'm running out of umbilical catheters, for example. I'm down to two umbilical
Oh, wow.
catheters for the island. We got an order in, but because of the typhoon, we don't know when that's going to come in next. So, there's that stuff. There's resource limitation, but it allows you to do what you need to do. It's truly wilderness or frontier medicine as best you can get in the United States, and I really appreciate that.
Wow. Now remind me, Michael, how many pediatricians are there? You're one of how many general pediatricians?
So, in terms of long-term pediatricians, I think we have about four long-term pediatricians on the island for a population of 40,000 people and about 12 or 13, 15,000 kids, I think, roughly around there. Um, we do have like pediatricians that come here for like locums for 2 or 3 months, but they don't stick around. They don't build rapport. They're not emotionally invested on this island. And so effectively, we're short staffed. We were short staffed from the very first day that I was here.
Wow. And is the issue with retention um, a cultural mismatch or an institutional mismatch, or people feel underprepared to practice medicine in that context? Or what do you think accounts for that?
It's multifaceted. As I mentioned, I think a lot of things, I think isolation is a huge part of it, right? Because the people who go to medical school have families, and their families tend to do better on the
Sure.
mainland, or they have contacts on the mainland. Second thing is that we take a pay cut. We don't get comp. I make a notable percentage lower than the pediatricians on the mainland. Um, Three, we deal with a lot more stuff, right? We had to be able to be ready for the worst of times, and the typhoon Sinlaku, for example, was a perfect example of that. And and between the geographical, economic, and also just the fact that some people frankly aren't ready to handle the acuity here and what's expected of you and how versatile you need to be to practice here, we don't have a high retention rate as a result.
Mm. And then, so for the young physician, or I guess reflecting on you 2 years ago, what did you turn to when you were put in these situations where you're doing a stat echo on a kid and you haven't done a stat echo in a while? And what resources do you and your colleagues use when?
First and foremost, me personally, I always say a quick prayer ahead of time and ask God to give me the wisdom and the capacity to do what I need to do. Secondly, we have the four long-term pediatricians here are incredible resources in terms of finding what we can do, where the devices are, where the tools are, and then ultimately, I think one thing that can be underestimated is I generally like who I work with, right? We're generally supportive here. None of us here are like truly malignant. Now, if there's someone who is like not up to snuff, we will not necessarily protect them, but we will make sure that we will support them and make sure that they can have the capacity to take care of the kids. And so that culture of respect, support, and also just understanding of where we are, it just permeates the practice.
So where do you think that culture of collegiality comes from? Is it comes from the
Trauma bonding.
yeah,
Let's be real.
probably.
It's trauma bonding. The reality is, we can't practice everything that we like in terms of standard of medicine in the States. And we've had some bad outcomes. And everybody here has some very sad stories. But we understand that and we understand each other. If a bad outcome happens, someone will reach out to you and ask if you're okay, if you need anything, if you need food, if you need just someone to eat dinner with, they'll ask you. The collegiality here is very understanding.
Hmm. And collegiality amongst practitioners and then between
Amongst the
practitioners and
practitioners and
nursing
the
staff.
nurses. The nurses surprisingly have been one of my biggest social blocks here in terms of just being able to feel the pulse of how I've been doing, because I'm actually currently I'm the only long-term I'm a pediatrician on the hospital service right now. Everyone else is locum tenens. And
Wow.
so the nurses and I know each other, and they know if they lose me, if I'm in an emotional slump, it
Sure.
affects everybody. And so they try their best to keep me in good spirits.
Wow. And so you're the only longstanding hospitalist pediatrician right now.
Hmm.
And so what does that mean? You have a set number of inpatient weeks or or because you also do outpatient clinic and outpatient, you do full
I do
spectrum
outpatient
pediatrics.
clinic as needed, but my main squeeze is basically full-time hospitalist. Any
Okay,
given month, on any given month, my schedule will be full with nothing but hospital shifts. I don't choose clinic days. I do clinic days if they need me to fill in a gap, but in terms of inpatient care coverage, I cover 50% of the shifts a month, basically.
I see.
Hmm.
That's quite strenuous. That's quite
it's
demanding.
it's it's a lot. It's a lot for the expectations, and it's not like a clean 1 week off, 1 week on schedule, which would normally be what your expectations are. It's kind of like it's one plus week on, and then you get 5 days off, then you get another 1 plus week on, and then you get a longer break, and so it's not like you have a big gap between everything.
Okay. So then, Michael, because it's been 2 years since we painted this picture of Saipan, I would ask you to paint that picture for us again. What exactly is this place that you're living in? What are the people who live there? Where do they come from? What is the culture of the community in which you find yourself?
All right,
Paint
as
that
you
picture for
mentioned.
us one more time.
Sure. So we live in the region called Micronesia. Micronesia includes islands like Guam, Pohnpei, Chuuk, Marshall Islands, and to a lesser degree, Palau. Um, that whole region is naturally inhabited by the various islanders. The native islanders to Saipan are the Chamorro people who historically occupied both here and Guam. Guam's only about a 1 hour plane ride south of us. Um, the Chamorros are the biggest islander group, but they are not the biggest ethnic group here. The biggest ethnic group here are the Filipinos, who came here with the hotel casino industry and never left when those industries collapsed. We also have, a fairly large East Asian admixture of Korean, Chinese, fewer Japanese, but they also exist. And then we have some Caucasians and some mainlanders like myself who live here, but a much smaller proportion. We also have a very active and notable fundamentalist Bengali community who came here
Really?
with who came here with the garment industry, and they are distinct because the female members of the community wear full length burqas
Oh, wow.
in this heat. They make probably, my guesstimation, they probably make 3 to 5% of the island.
Oh, wow. It's a
Mhm.
sizable minority.
It's a sizable minority.
And the official language is
English, because it's a
English
U.S. territory.
because it's a U.S. territory.
But the
And
unofficial native language is both Chamorro and Carolinian.
okay.
Mhm.
But the spoken, if you were to walk down the street, English is
English.
really okay.
English and Tagalog are going to be your best friends.
Okay. And so
Mhm.
all of your patients then speak to you in English and have a level of health literacy that you would find on par with Philadelphia or
Ah, well, it depends. North Philly, possibly.
okay,
Center City, probably not so much.
sure.
Um, just as with Polynesia and much of the Pacific, we have all the typical islander problems here: obesity, diabetes, the sugars, the
Yeah.
gout, all that stuff. And spam is quite popular here, and you give as much advice as you want, outpatient wise, but they'll just keep on going back to that Coca-Cola stuff. And so, it's same. I guess same as North Philly. Let's go for North Philly.
So in a nutshell, exactly the same as Philadelphia.
Meth is also popular here.
Oh, interesting. Is that true?
Oh yeah, oh yeah, because it's so easy to make. All you need is get some cough syrup from China, put it in a microwave with some
Oh,
antifreeze, and there you go.
I didn't know that. Is that that's the biggest drug problem on
That's
the
the biggest drug problem, and I would say I would dare out to say that probably up to 40% of the islanders, if not more, probably have some dealing with the drug. And of course, weed here is legal, and so everyone smokes like a chimney. So there's that too.
thing. And is your hospital a burn center?
No, we are not, but we have to be.
Sure. Yeah. Would the closest one be Guam?
No, I don't think Guam even has a burn center. They have surgeons, but they don't have a burn
They don't
center.
have a burn center.
Truly, the only burn center that's connected to us, if you're an adult, you probably go to Hawaii. If you are a kid, you have to be transferred to San Diego or something.
And so for a reminder, Hawaii is how far from you and San Diego is how far from you?
Hawaii, right now, currently with the current plane schedule, it's a 1 hour flight to Guam, then an 18-hour layover, then a 7 hour flight from Guam to Hawaii.
And so the sick kids, or maybe in the last year, let's say, maybe 2 years is a stretch. In the last
Mhm.
year, how often have you had to transport a critically ill infant or child?
It comes in clusters, man. And sometimes we do 3D in 1 month, and then sometimes there's months that we don't do anything. But for example, I'm doing one right now. This one is the kid, I think, has a gastric duplication that's completely obstructing its outflow of the stomach. And so that one is right now. And then the last kid that we sent off was about 2 weeks ago.
Oh,
But that kid unfortunately did not make it in time for us to get out. But we were trying to get the kid get off island, and then the next one was a week before that. So it comes in clusters, and then prior to that, we had like 2 months of relative peace.
wow. And
Mhm.
so what's that like transporting a child or an infant? Tell us more like that. It's a small aircraft or you're flying economy on a commercial
We are
airline.
flying economy on the United Air Airlines. You get occupied a center row. You, the nurse, the patient, and their legal guardian will go on this flight. And the kids themselves, depending on the pathology, may give you a lot of trouble or hardly any trouble. And my first one was, as I mentioned, a rectal atresia with severe gastric compression and compartment syndrome. That was not great, stressful. But then we had some kid who had MOG antibody-mediated encephalitis and who went blind in both eyes from autoimmune inflammation. He did fine. That was the easiest transport I ever did.
But when there's passengers flying commercial airlines on the
Oh
same
yeah,
flight.
yeah. You don't charter a whole plane yourself. You go on economy.
Fascinating.
Oh, I am sorry. I may have to pick up. There is my landlord's probably here. Just give me a
Oh,
second.
okay, sure.
Hi, good morning. Everyone okay? Huh? Good course. Oh, you remember that? Last night I come here. You know. Yes, yes. No, so I did not explain. I hope discount this one. Oh, you want discount? It's not 900. Oh, so I received it 900. Okay, okay. So can you change it? Oh, yeah, sure. Yeah, okay. I'm in the middle of the meeting. I'll walk to your house to give you this, okay? Okay, I'll give you one later, okay? Okay, thank you. All right, sorry about that. Was
Okay.
my landlords and saying that because we had issues with the housing after the typhoon, he's giving us a discount. So
Oh, that's
yeah,
very nice. That's
yeah,
very nice. Um,
yeah,
you were telling me, so you're transporting these kids who are in variable states of being sick.
yeah. On
Um,
United Air Class economy in the middle of the aisle with everyone else around you.
and you're able to monitor vitals, or do you
To a
have?
degree, we had the pulse ox, right? And you can do whatever you bring with you. But like some things like an infantile blood pressure, you can't get an accurate read on that on an airplane because the cups aren't big enough, and we just can't bring the NICU with us. And so a lot of times it's just clinical appearance and perfusion, and you really have to use your entire judgment.
Wow. And
Hmm.
oh, sorry, I didn't mean to interrupt.
No, no, I didn't have anything to say.
Oh, I was just curious. I mean that is so far outside the realm of what I think a graduating pediatrics resident would envision themselves doing within their first year of being a fully autonomous attending.
I
Um,
think I think it would be healthy to have some experience of chaos before coming here, because fortunately, I would say that 80% of the time it's not terrible,
yeah,
but then it's that 20% of the time where things get really bad. It's enough to keep you very very busy and on your feet.
sure. And so tell me, I guess this is more of an educational question, but if you could go back to your residency training, uh,
Mhm.
understanding the demands that would be placed on you today, what do you think you would have focused more intensively on or tried to get more exposure to?
I think honestly, and this is going to probably rub nurse practitioners the wrong way, is getting and the fellows is more procedures.
Sure.
Medical school, particularly in pediatrics and the primary care residencies, they have been moving away as a whole from teaching residents procedures because they want the nurse practitioners who will stick around that program to learn them. They
Yeah.
also want the fellows to learn them. But for residents, for like people like me during residency, we were like third tier. If the
Yeah.
fellow didn't want to do it, then the nurse practitioner got priority. If the nurse practitioner didn't want to do it, then the residents got handle of it. And that's true with my program and with many pediatric programs. And so it's gotten to the point where things like putting a chest tube, and it's like I haven't done that ever, but I will do it here. I just got to pull up a YouTube video and try my best. But this is where the training knowledge gap is brewing in America, whether people want to acknowledge it or not. They're neglecting to train their physicians adequately to prepare for chaos situations like this.
Sure. I wonder if that's just reflective of the big academic centers where
I would
they're,
imagine the community centers would be a little bit more resident focused,
yeah,
right? But nobody intentionally, as far as I can tell, who wants to go to a higher a greater training ever applies to a community-based program first.
I see.
Yeah.
So you would try and get more exposure to procedures.
Hmm.
What about more critical care medicine or,
I did electives in critical care and
okay,
residency, so I think I was well prepared for that. I think at least I'll give credit to my residency at the time. They worked us very hard. And so when the volume is high here and when the pathology is high, it just feels like another day in residency. And so far, I'm not burnt out yet. So I'm still running.
do you guys have an EMR?
We do have an EMR. It's a very archaic EMR from the early 2000s. You don't want it.
It's have you been at the VA? Is it similar to their?
I don't know. There's the fortune. I don't think I've ever been to the VA, so I don't
Okay.
know how to compare it. But it's
Okay.
it's it's archaic. It has its glitches, but it's fairly user friendly in that regard. But it just doesn't, for example, put all the information in front of you, and you have to absolutely know what you're ordering and how to order it in order to order it properly.
Oh, interesting. There's no pre-populated dose based on like a patient's weight, the way it is in Epic or
No,
something.
no, you have to do the math.
Really?
Yeah.
So if are you ordering TPN or
Oh yeah.
infant formulas
Oh
and
yeah.
calculating all of that on your own?
Hmm. Hmm.
Very impressive.
Full scope math.
I'm trying to remember the last time anyone I know has calculated TPN on their own. Oh,
No, that's a regular thing. I did it just yesterday. I mean, it's a thing here.
wow. And okay, so then more procedures. You had an adequate exposure to critical care medicine. Anything
Mhm.
else for
I
and I'm asking this for physicians who think that they will want to work in maybe lower resource settings in the future. What are the skills, the tangible skills that they should maybe focus on towards the end of their residency?
I think, residency trains you to handle, at least it should be able to train you to handle a high volume and high crisis situation. One thing that residency does not do a good job of teaching you is how to work outside the box. Because,
Sure.
here in Saipan, like I said, we're down to 2 UVCs left until the next shipment comes in, right? Hopefully within the next week or so. But for example, if the UVCs don't come in time and you have a kid who needs TPN, what are you going to do? Do you have, what are your resources? Can you place a central line in a baby? Can you do a neopic in a kid? Can you get by with just doing peripheral TPN? All these things about critical thinking in terms of what your toolbox is and what your reality is. Residency, it's a different animal altogether because you have everything at your tips. You want a UVC, you got it. You want a UAC, you got it. You want to pick the pick team will come and do it for
Yeah.
you. That's not here. Everything is on your hands and is on your mind, and it's your job to see what's in the toolbox that you can use to bridge the kid from point A to point B and then from B to point C. That's all on you, and you can be creative about it. If you have to use a replogal for a butt tube, go for it. I mean, I've
Sure.
done that before.
Sure.
So it's all about and like this past week, since the typhoon, our radiologist, for example, has left the island. We don't have an on-island radiologist right
Oh,
now.
you're kidding me.
No. And so I was protocolizing upper GIs myself, and also protocolizing CT anatomies of CT anatomy scans of the abdomen myself because there's no one there. Um, One thing, and I hate to say AI, but AI unfortunately has, but for better or for worse, for ethical qualms or whatever, is becoming bigger and bigger parts of our society. And whereas up to date was probably my resource in terms of looking up information, more recently, I believe it's open source. It has been
Hmm.
a good supplement as well. And for things that up to date won't necessarily give you, for example,
Sure.
how to dilute properly the omnipaque in order get it to show
Yes.
show adequately in the anatomy scan,
Yes.
right? And so all those things.
Wow. I do a lot of the people on the island, are they incorporating open AI and some of the AI tools?
Yeah, yeah, yeah. I know for a fact, the department I work closest with is the OB-GYN department, and they are using AI as well in terms of at least sourcing information. Again, AI right now in its current form has a very limited use in medicine. You have to be able to present the findings and your concerns properly, and read their answers or responses in proper context in order to provide adequate treatment. If I said, for example, how to dilute omnipaque onto the OpenAI, they would probably automatically default me onto the adult
Oh,
dosage, which everybody knows is incorrect for kids. And so
sure.
you have to be very specific. You have to know how to ask the question. Then when you see a wrong or off answer, you have to recognize it. So AI has not made the physician brain obsolete yet.
Hmm.
It should be a supplement, but never should be primary.
Sure. So, would you say that I'm curious because I don't know that I have talked to anyone yet who's using it um, as regularly in their clinical practice as it sounds like you guys are using out there. Um,
Mhm.
do you find that you guys are achieving a reasonable relationship with AI or have struck that balance in your clinical practice between relying on it and using your clinical intuition?
Thus far, I think it's okay. Like I said, I still, at the end of the day, I acknowledge that every decision I make is my decision. It's not AI's decision, right? We are the ones who place the orders in, and we are the ones who say this rash looks, vesicular
Yeah,
versus bullous, right? And so it's a supplement. It's not the primary. I basically just use it as a backup to up to date if I can't find the
sure.
information that I need to do on that. And AI is fraught with imperfections, right? And so you have to acknowledge that there is limitations to AI. It's a supplement. It's never the primary.
Sure. Yeah, it's interesting. I think understand it for reasons that are very understandable. You guys have to rely more heavily on some of this new and emerging technology than I think a lot of us have had to so far.
Mm-hmm.
Um, okay, so let's see. I wanted to hear a little bit more about this typhoon because it's been a big deal for you and a big deal for the island. And I sense in some way that it sealed your fate to that of your island.
Pretty
Maybe
much.
maybe that yeah, maybe
Yeah,
that's I
yeah. The,
get the sense that that's an appropriate link.
I think that's a very appropriate way to view it because
Tell me about the
you know
typhoon.
this job I think was supposed to be temporary for me. You know that I was supposed to go back to the mainland after a year
Yes.
or two after here, to be closer to family and to just to continue to build relationships. That obviously didn't happen because I'm still here. But the typhoon, first off, was an off-season typhoon. It struck in April. The normal typhoon hurricane season doesn't usually start until mid-June. So it came about a month and a half or 2 months early. Um, it started off as a tropical depression towards Chuuk, one of the Micronesian islands out east of us. And then, it wasn't supposed to hit us. It was supposed to hit Guam. But within 24 hours, it was clear it was going to hit us. And at that point in time, within 24 hours, it had strengthened from basically nothing to super typhoon status. And to the worst part of it all was it was only moving, get this, 5 to 3 miles an hour. So it was a very slow moving storm.
Okay.
The combination of a direct impact, the super typhoon status, which the winds was like, I think, peaked at around 145 or so. We got about 135 here on the hospital. I'm a hospital read.
Wow.
Um, but it moving slow meant that we had typhoon or hurricane force winds for over 3 days. I came into the hospital Monday morning with the intention of leaving Wednesday morning for the hurricane shift. I didn't get to leave until Thursday afternoon, more or less,
Wow.
because of the slowness of the storm. And even on Thursday, we were still having hurricane force winds. The eye basically sat on us for almost 8 hours because it
Oh,
was moving so slow. And so if anyone who's lived in Florida before or has ever experienced a tropical storm or a hurricane knows that for the most part, the hurricanes and tropical storms are 1 day events, and they
mm,
can cause a lot of damage there. This was a 3 day event, and we just did not get any relief during those 3 days. The infrastructure is down. I didn't get power for almost over a month, and then everyone else on the island, we still are probably about 50% blacked out right now, and it's been almost 2 months in. Um, it destroyed, first off, this island's in a very tough spot because we were already kind of on a decline in terms of economic tourism because the cost of living is so high in the US, and our main tourism market is in Korea. They're not coming now. They canceled all flights from Korea for the foreseeable future. Um, we don't have any direct flights to Saipan at all, aside from Guam. No one's going to come here and to support the economy. Not only that, but ecologically, this island is devastated. I would say probably a third of the trees on this island are probably down. Um,
wow.
yeah, or tilted or put into a more abundant position because of the storm. Um, the signature flame trees, the one with the red flowers that we build our culture around here in Saipan. I would say probably half of those trees are gone because the wood itself is fairly soft, and the older trees, the older growths in particular, took a really hard hitting. And then of course you have to think about the animals that live here. The coral reefs, they suffered immensely. The endangered bird species here, native bird species, they don't have any habitat or food to eat. The territory's bird, the Mariana's fruit pigeon, where are they going to get the fruit for the next 3 months? We don't have anything, and so we it's kind of a pivot point right now of seeing how well this island recovers because we've gotten hit by super typhoons before, but I don't think we've ever had one that was a so long, b hit at such a critical time, and c cause as much devastation as this one has ecologically. And so I think, as much as I hate to say it, I think what we're going to see in the next couple of years is basically a larger scale of drain of the island,
Mm.
of people leaving here.
So that's awful.
Yeah.
Um, I've never lived through a tropical storm.
Oh, it's fun. You should try.
I know you're a Florida man, so you have a little bit more experience in this than I do. But just paint the picture of what it's like being in Saipan during a super typhoon. Like what is it? What does that actually mean?
So we are an island, so oceans all around, right? You can't run away from water. Water is everywhere.
Yeah.
We also have basic infrastructure, meaning that the poles are dated, electrical systems dated, the water system is dated, everything here is dated. Um, Fortunately, most of the houses are made of concrete, so they can stand a hit, but everything else around it, the trees, not really. I was working during the typhoon, and so I was holed up in the hospital. But the typhoon was so strong that it actually, and our hospital is full concrete, mind you, and stormproof supposedly, that the northern wing which is actually the southern wing of the maternity ward had to be evacuated because the winds were pushing the doors open.
Wow.
And so, and like I said, the wind speed itself not that bad, 135. When it came here in Saipan, but it's just the length, and everything has a limitation in terms of how much stress it can take. And all the solar panels that everyone installed in response to rising gas prices got blown off, debris everywhere. And of course, the it wasn't such an issue for me because the hospital system had an underground communication system, but everyone else on the island had lost contact with their relatives on the mainland for a probably the better part of 1 week or two.
Wow.
Um, and I had people reach out from the mainland to me asking if I can find people living in this
Oh,
so and so village because they had no way of contacting them. Now, the remarkable thing about all of this is that nobody actually, technically, on at least on the land anyway, nobody died here. No one got drowned in storm surge. We were all very fortunate because the locals know what to do during a typhoon. But this was still a major event, and it wrecked our infrastructure. And for example, I had to transfer a kid out, and I couldn't get him out on time because everything was so delayed, and then he ultimately passed. So everything gets set back because of the storm, and then you have to learn how to make do. We were out of diapers for preemies for almost 3 days.
gosh.
And
Wow.
so we got creative, and then we eventually had to source it. And so things, you really don't know how resourceful you can be until you get put into your foot gets put to the burner.
Sure.
And so it's been an adventure. The
So the hospital had power.
hospital had power because hospital has its own generator.
Okay.
Hospital, however, did not have good drainage. And so at one point in the storm, the hospital also flooded. And so and it was remarkable because it water was just pouring through the front entrances of the hospital, and I was like, What are we doing here? And you just have people just, even this hospital CEO was actually taking buckets of water and just trying to pour it down the toilets or whatever and pour it out.
Wow. Wow.
But being a Florida boy, I knew what to do, and I was able to tamponade the doors and keep the water from coming in until we were able to access the drainage issue. But yeah, that was fun.
And this might seem like a very obvious question, but I'm curious, in what ways was patient care affected?
Fortunately, besides the stress for on the at least on the pediatric side, I can't comment on the adult side. I know the adult side had quite a few fatalities that weekend. I'm not sure if they were related to the storm or not. But at least on the pediatric side, it was mostly just access to resources.
Mm.
And we had limitations in access to resources. And we had difficulty in our logistics of getting people out. But we can be creative, and we were able to address at least 95% of the problems with MacGyvering one thing or another. So
And so 2 months out, what are the glaring deficiencies in infrastructure?
for the healthcare infrastructure, it's pretty much back to normal, more or less. We're just waiting for shipments of things to arrive. In terms of the power grid, still I would say about 50% of the island does not have electricity. If you live on the main road, you're good. If you're off the main road, you're not. They're still working on putting power poles, lines in, and transformers. Oh, and fun fact: did you know that our power plant is oceanfront?
Oh
So
no.
how well did you think that was going to go for them?
Oh no.
Exactly. So the reason why that nobody had power for the first month was because the generators were permanently damaged, and we had to ship in new generators from the mainland.
Wow.
Used
Oh my gosh. And what is, remind me, the main economy on the island used to be tourism.
to be tourism. Yep.
Um,
Still is technically tourism, but it's less of it now.
there's just less of it.
Hmm.
So the lack of power to 50% of the island is a huge hit.
It's a huge hit. And the cost of diesel now to run anything, given our current Middle Eastern conflict milieu, is incredibly expensive. Gasoline, not diesel. Gasoline here is already $6.11 a gallon, just to buy. And then diesel, I think, is $1 or $2 more than that, right? So it's running $8 or $9 a gallon, and
Mhm.
so it's very expensive to run generators, and a lot of families can't afford to do that.
So, what have you sort of noticed in the last 2 months in your patient population as a result of the typhoon? I'm curious.
A lot of sick babies, a
A lot of
lot of sick babies, a lot of critically sick babies, and it's
because
not
care was
like,
delayed
huh?
because care was delayed, or
No, not even that. I think the typhoon, if you believe the barometric theory, which I don't know if I do, but supposedly there's a correlation between a significant drop in barometric pressure and premature births. We've had a lot of premature births in the last 2 months. Mhm. Um, that plus kids who I think because of maternal stress aren't doing so hot. We had like 3 back-to-back meconium aspiration syndromes, like genuinely bad meconium aspiration syndromes, where the kids have to be intubated and and,
oh
and
gosh.
bagged and kept you guys up all night, right? And so we had that, and then there was like one kid who didn't look like he had meconium aspiration, but the mom's amniotic fluid was very, very viscous. I've never seen anything like it. It looks like it was syrup. And so that kid had also had respiratory difficulties. I think, all things considered, what it is that the stress of the storm was so bad on the families and the mothers that they eventually transmitted some of that stress in one way or the other to the kids, and that just led to bad outcomes.
Wow. And you're still seeing obviously 2 months is not that far out. You're still
No,
seeing the
I'm still seeing that stuff. I'm still seeing stuff.
Are things getting better?
It's tapering off just a little bit, right? But then you have the new problems of kids with these raging cellulitises that normally shouldn't happen in normal healthy kids, but because of the lack of sanitation and bathing water in some places. It just happens.
A lot of homes are still without running water.
A lot of homes are without roofs.
Right.
Running water for the most part. If you live on the main villages, you have running water, but that's not to say that your house is adequate enough to actually run the water, right? If you have no roof, if your walls have collapsed, then you have no running water.
And what was the relief effort like? Just
So that's fun. That's an interesting topic. So, how much faith do you have in the U.S. government?
I don't
Don't
know.
answer that. I'll answer. I will answer this for you. Okay, so the first people here to actually land on island to actually provide us relief and support was not the Red Cross, was not FEMA. It was Samaritan's Purse.
Interesting.
These private, faith-based organizations were here first.
Really?
They were here first. They were here first. FEMA didn't really truly get feet on the ground till like almost a week and a half or 2 weeks after the storm. They were just sitting in
Kidding
Guam
me.
waiting for paperwork, more or less.
And so
You,
how soon was Samaritan's Purse there?
within like 3 days.
Really?
The, yeah, the storm left us on Thursday. Samaritan's Purse had first boots on the ground by Sunday.
Wow.
The National Guard wasn't even here by that time. The National Guard took almost a week and that week to get here, right? And so, yeah, Samaritan's Purse. I had to give it to them. They respond quickest to the needs of the people here.
Hmm.
And that should tell you loads about what you can do outside the realm of government and why you shouldn't put all your eggs in government support, because government, once they're here they did good, but it takes them a while, right? Because they have government has paperwork, government has clearance, government
Sure.
has laws.
Bureaucracy, sure.
Yeah, if you are a private organization, all it takes is just the head of the organization, or a convening group saying, "This place needs us. Let's mobilize our resources," and that's it.
And
And so
they brought medical personnel.
they brought medical personnel. They actually set up a clinic outside our hospital to help offload the overflow the ER was going to get, and they did a fantastic job with that. They also Samaritan's Purse was one of the first people to come here. World Central Kitchen was also one of the first responders here, and they were able to address, between Samaritan's Purse and World Central Kitchen, they were able to address the people's first or most immediate concerns. I didn't get my first emergency delivery of water until about 3 weeks ago from FEMA. Ironically enough, I wasn't seeking it, but they certainly weren't handing it out up until about 3 weeks ago. So I was like, okay, well.
Wow.
But the military was here faster than FEMA. The National Guard was here faster than FEMA. And, you could also possibly correlate the FEMA's delay in response to the current administration's cut of budgets, and that's also a fair argument. But having been through tropical systems before and seeing how things work between the federal government and versus private organizations, I think this is actually probably just par for the course. Maybe a little bit longer because of the government cuts. But Samaritan's Purse, and I've talked to the Samaritan's Purse people, and they basically said they always show up before FEMA does.
Really?
Always.
Hmm.
And so, okay, yeah, I believe it.
So for context, Michael, this was a classified as a super typhoon. How
Mhm.
often does a super typhoon hit Saipan? Is this an annual
The,
occurrence?
the official answer is not very often.
Okay.
And depending on which camp you subscribe to the whole climate change argument, the answer is the things are changing.
Okay.
Prior to 2010, they've had very seldom get hit by tropical storms. Not just super typhoons, very seldom tropical storms in general. It's
Mm.
not their thing. It's not something that the locals have it in their oral lore in terms of having frequent storms. But since 2010, we've had 3 super typhoons hit us.
Wow.
Yeah. The most recent one, I believe, is U2. U2 was actually the strongest super typhoon of that year, and it hit us. It only hit us for like 6 hours or so. Like the core of the storm was only here for 6 hours, but that storm was so strong that it stripped the asphalt off the the airport runway, so they couldn't even get airplanes in adequately. And so if you believe the last, if you use at least the last 50, 60 years as a model, the answer is we're not supposed to get hit by a lot, but in the last decade we've got hit by three.
Wow. So
Mm-hmm.
this is in the context of Saipan's history, this is
This
significant.
is this is increasing, yeah. And this storm was an off-season storm. Should not have existed. Should not have existed, and at the strength that it was.
Sure. And how much warning did you have?
Oh, we had a lot of warning because this guy was moving so damn slow. Yeah,
Yeah, oh, that's right. It was a very slow moving.
yeah, yeah.
Um, wow. And so I'm sorry, 2 months into it, I'm guessing there's still 50% of the population without electricity.
Mhm.
Um, Obviously, roads infrastructure is heavily damaged.
Yep.
What else needs doing out there?
School needs to start again. Like, these kids have not had formal schooling since April.
Oh, wow.
I think we just had basically had our graduation ceremony this yesterday, effectively, but they didn't have any school during that period of time.
And so
So
parents are staying home because kids aren't in school.
pretty much, a lot of them are, right. Most of the stores on the main strip have opened up again, fortunately, but the kids have nowhere to go,
And
and the kids also don't have power at home. So it's not like they can go online
yeah.
learn anything.
What are they doing, Michael? That's what are your kids doing?
That's funny. That's a good thing. So a lot. So not all kids, but there are some organizations here that are trying to step up and provide something to the gap. One of the organizations, and I'll send you pictures of this later. One of the organizations that I've seen here more often working now is the Saipan Awadori group. Awadori is a traditional Japanese dance style that Japanese during their colonization here brought over from Japan to Saipan, and that's continuing on as a tradition since school has been out. Mrs. Masako, who is the CEO and leader of that organization, has been holding daily practice
Oh, wow.
for this dance troupe, and also drumming and teaching flutes and all that stuff. And so that part is done. There's some civic organizations among the associated with churches that are asking the youth to step up and provide volunteering activities and so on and so forth. But it's still very limited, right? There's only so much you can do. Um, so yeah, no
Yeah,
school yet.
I was so curious because I think here in the US we saw what, during COVID, those what that level of social isolation did to young children and their mental
Yeah.
health and
But
they
the good thing about the island is but people here are social outside of school still,
are they?
right? Yeah, this is island culture, man. Everyone's just sitting on the beach and just grilling something.
So maybe that same level of social isolation doesn't exist there that it
No,
does
no,
here.
no. COVID was special because everyone was expected to stay within their houses. Here, there's no houses, but there's lots outside. So, so that's not a problem. The island people, even during COVID here, they were still very, very closely connected because it's just the family island culture here. No
Sure,
one here, no, you live on an island, but no man is an island.
sure. Most children don't leave the island. Is that correct?
Actually, I feel like most children end up, well, let me put it this way. Most children who go to college leave the island at some point in time because there's a
Okay.
limitation in what the local community college here can provide. Um,
So like what
most
percent of your patients, if you had to guess, eventually leave the island?
Well, it depends on what age they have a baby, Carissa.
Oh,
If I
sure,
were to be really,
sure,
if they have a baby, then 0% chance.
sure.
If they intend to pursue higher education, almost 90% leave the
Okay,
island.
okay. Wow.
Very only a fraction of that return. But if you don't want to go anything beyond a community college level, then they just stay here
Sure,
to catch fish.
sure. So Michael, I'm curious in what way you feel like your fate was sealed to the island during this storm. And more specifically, how has this island now become your home?
I hate to call it my home, to be honest, because home is always Georgia. Home is where my
Sure,
family is. I'm here by myself, right?
sure,
But it's becoming a home in the sense that during the storm, when people were talking about leaving the island and going back to the mainland, that was not on the table for me. That felt like you're abandoning people when they need it.
Yeah.
That was never that was we had one pediatrician who was supposed to come here 2 weeks after the storm, before the storm hit, and then the storm hit, and then she backed out and didn't show up for almost 2 months.
Wow.
That didn't seem right with me. It's like, okay. And at that point in time, I realized I think these are my people. As much as I hate to admit and hate to say it, these are my people, and I can't abandon them.
Yeah.
And the way I see it right now is like we have so few long-term pediatricians here that to lose even one long-term pediatrician is a great loss in terms of continuity, in terms of know-how, in terms of the skill set, right? And so, yeah, I'm not leaving. This is my ish for the next couple of years. The only thing that would possibly bring me back to the mainland now would be if my parents became ill
Sure.
and I had to come over and pick up the slack. But even if we had an escalation in tension with China, I don't know if I'll be able to leave the island. And we would be our first target from China because we're so damn close to China.
Sure.
But even if there was a Pacific conflict, I don't think I can leave the island. I don't think I can leave my people.
It's really remarkable to hear you say that because 2 years ago you were just settling in and I think everything was still so new and foreign and
Yeah.
you never have anticipated, I think, saying that.
No, no. No. But here we are 2 years later. And also I realized that I've gotten a lot more cowboy in terms of my medical practice, that I
Sure.
will probably honestly be a very poor fit for American medicine, and that they would probably have to push me into corners that I don't necessarily like.
Sure.
Like I'll give you an example. 2 weeks ago, I was called in for an emergency. Right, I showed up in a tank top and flip flops into the neonatal ICU, and I put a line in that kid. Where else can you do that? Right? It's like this is such a normal day-to-day occurrence for me. I don't even put bad eyes about it, but this is what you're doing.
Um, I'm sure that the any hospital anywhere in the world would be very lucky to have you. I do think that you have found a very unique place that suits you and plays to every single one of your strengths. And
Yeah.
part of me, that's that's sort of the hardest question to do professionally is where do you find that for yourself? And I think you've done that in a way that is just very, very impressive.
Yeah. One thing I would like, tell any, not just pediatricians, but any doctor in general is like, and my background. You know that I worked at CHOP, I worked in,
Yeah.
cardiology, I worked in
Yeah.
various locations. This is honestly the first job that I could feel like I could probably do until I retire
Really?
sustainably. Right. Because CHOP was burning me on both ends, right? That place was miserable. But pathology was cool. The stuff we were doing was cool, but it was also very taxing. And I couldn't do it for more than a few years. The other jobs I had also burned you out incredibly high. This job I can do, even though it works you hard. The mission behind this job, the fulfillment behind this job, makes it something that I can wake up every morning and be grateful that I can do. And you can't say that with everything.
Sure. So, Michael, I think that's also I think that's a beautiful way to end. I can't imagine the first 2 years of attending hood in any specialty are just so nerve-wracking and anxiety inducing. But to hear how you've gotten so much clarity from it, I think is quite remarkable.
Yeah. I don't know if it's clarity. It might just be an adrenaline rush. I might have just had like a 2 year long adrenaline rush.
Yeah.
I
No,
don't time to think yet.
is there anything else you want to tell us about your 2 years on the island?
Mm, not quite. I think, well, the one thing I don't have sustainable right now, and this is the reality of just my personality and just the way where I am, is the isolation here is pretty severe, right? I can't go and see my family on a drop of a hat here. I can't see you
Yeah.
without significant planning a year in advance, probably at this point.
Yeah.
Um, it's always healthy to have a interior life that keeps you balanced, whether that's family, your spiritual practice, or whatever, because nobody can do this
Yeah,
job without something supporting them, because
sure,
it does tax you. And so, yeah, keep your interior life healthy, whatever that may look like for you. Don't go Allahu Akbar on us, but keep your interior life healthy.
sure. I think maybe for you also the ability to travel all over East Asia might
Yeah,
have helped in some way.
yeah, it does. I have friends that I visit when I go to East Asia, and I'm doing a mission trip, believe it or not, in 2 weeks in Vietnam.
Oh, wow.
Um, yeah, there's my first love in medicine was not cardiology; it was global medicine.
Yeah,
This is as close to U.S. based global medicine as you can get.
for sure.
And with this job, I can actually have the flexibility to do work on the homeland in the homeland as well. And so it's almost like a full circle poetic
Yeah,
end for me in terms of a job.
yeah.
So yeah, this is great. Come to Saipan, please. We need people.
Yeah. Well, I'm excited to follow the story of how you guys continue to rebuild after this disaster. And it sounds like none of the big organizations are still actively soliciting donations. But if there's
Yeah,
anything,
there's a GoFundMe for Saipan, but reality is at this point in time, you don't need there's no need for it. The government has
okay,
come in.
okay.
We'll be okay.
Well, Michael, if there's nothing else you wanted to share with us about your first 2 years, I know you're a very busy man, and I will let you go. I really, really appreciated your giving us an update today.
Yeah. Well, I appreciate seeing you again. It's you're a dear friend. Anything for you, and it's always good to hear your voice.
Thank you, Michael. We'll chat soon, and I'm looking forward to more updates from your island.
Hmm. All right,
All right.
perfect. Wonderful.